everyone, my name is Whitney and I am a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Let's talk about root canals. So what is a root canal? A root canal is often abbreviated as RCT, root canal therapy or root canal treatment. And with root canals, you'll probably hear your dentist use the words endodontic treatment, or you may even see an endodontist, which is a root canal specialist. A root canal procedure is typically one of your last options to save a tooth that is severely decayed, damaged, abscessed, or dying. Instead of extracting the tooth, instead of pulling it out, a root canal procedure removes the nerve tissues from your tooth and seals off the hollow chambers. It's kind of like putting a filling where your nerve once was, which preserves and saves your natural tooth. And depending on which tooth in your mouth is being treated, the process and the cost will vary. Some teeth only have one canal because there's only one root, most of the front teeth. Whereas the other teeth, the back teeth, will often have 3 or 4 canals and will sometimes even have curved and twisted roots. So all of these factors combined with your dentist's own personal experience and resources will determine whether you will have the root canal procedure done at your usual dentist office or if you'll be referred to see an endodontist, who, like we said, is the root canal specialist. Now, lots of patients ask me, if you had a root canal, do you need a crown? And the answer is generally yes. If you had a root canal, you will need a crown, especially on the back teeth. Now, sometimes if you had a root canal in one of your front teeth, they can maybe patch it up with bonding material instead of a crown, but this is always determined on a case-by-case situation depending on the status of your remaining tooth structure. But general rule of thumb, here in the US, you will always need a crown after getting a root canal on your back teeth, your molar teeth and your premolar teeth. Now, the other question is, can you have a crown without getting a root canal? And this is a more straightforward answer of yes, absolutely. It is very common for a patient to need a crown but not need a root canal. Oftentimes you'll need a crown due to tooth decay on the crown portion of the tooth. And if there is no infection in the root portion of the tooth, the decay did not reach the nerve, then you wouldn't need a root canal. You would just need a crown. So needing a root canal usually involves decay and infections. But it can also be associated with past trauma of the nerve of your tooth, or from a hairline fracture down the root of the tooth. And also, sometimes with trauma, it can actually catch you by surprise years down the road. Like if you got hit in the face as a kid, the issue might not show up on your teeth until you're an adult. So how would you know if you need a root canal? Well, of course, your dentist would tell you from examining the tooth in question with x-rays, different bite tests, and stimulus tests. So if you are ever concerned that you may need a root canal, best advice is to always visit your dentist's office ASAP. But until then, here are some red flags to look out for, some warning signs that your tooth may be headed into root canal territory. Severe pain, the type of pain that doesn't go away, throbbing all night type of pain. A sore on your gums by one tooth. Sometimes with an abscess, you can see a little bubble above the tooth on your gums. Also, this little bubble is called a fistula, and fistulas can come and go, but the abscess will remain until the root canal is completed. So it's super important to be aware that just because the bubble went away does not mean your tooth healed itself. It definitely didn't. The bubble will always come back, and oftentimes it comes back with more pain than before. Pressure sensitivity, like when you bite down, you feel pain, and or heat sensitivity. Cold sensitivity can mean lots of different things, lots of no big deal things, but when you have a tooth that isn't responding well to hot foods and drinks, definitely a red flag. And before we go, something that lots of patients told me they didn't realize when they were getting a root canal is that they didn't realize that a root canal often starts as a cavity. I know we mentioned it could also be because of trauma or a fracture, but more often than not, it is because of tooth decay that got bigger, which could have been prevented. That's why it's so important to schedule a filling appointment if your dentist recommends you get a cavity filled. This is because tooth decay spreads. And if it spreads to the nerve of the tooth, it becomes an abscess, which causes swelling inside of the tooth, which can create a cyst or an area of drainage out of the tip of the root, aka an infection. So if your dentist says you have a cavity and you need a filling, I can't stress enough how important it is to schedule that cavity filling appointment so you don't ever have to worry about that tooth making its way into root canal territory. I actually have a whole video all about that, which I will link below if you're interested, but the message of that video is if you don't get things treated, they will always turn into something worse if you wait too long. Putting off filling a cavity can turn into a root canal, and putting off getting a root canal can turn into the tooth becoming unsalvageable, aka needing to get it pulled. So in all, don't wait until something hurts to seek out dental care. Routine dental appointments and catching things before they hurt is key to giving you a better chance to save and preserve all of your natural teeth. I hope this video helped you. Please like and subscribe and turn on your notifications if it did. And until next time, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and teeth.